Hello and welcome to this webinar. This is I'm Francis Seeley from GlobalNet 21, and I'll tell you a bit about that in a minute. But I just want to welcome you to this webinar because it's what we call a sort of webinar seminar or webinar workshop, and it's the first one of this kind that we've done. So it's a sort of experiment, a pilot. But I hope it will go well. The problem with webinars is there are always problems sometimes with technical difficulties, but hopefully we won't confront any of those today. But it should go smoothly. What I want to do first of all is just tell you a bit about us. GlobalNet 21 and the Local Government Information Unit are jointly running this webinar. We're collaborating to develop it and to introduce it to you. You may not know much about GlobalNet 21, but we came into being to try to get people to discuss the big issues of the 21st century. And we hold lots of meetings, many in the House of Commons, in other places as well. But we do a lot of webinars, a lot of online webinars, which often includes a global audience. And so we're doing this one as a different kind of webinar as an experiment. If you want to know a bit about GlobalNet 21, if you look on the right of your screen now, you will see a caption up there, which will let you visit our website if you would like to do that. Can I say, as you're looking at it, this webinar will be recorded, and within a couple of hours of it finishing, you should get a link to the recording. So you don't have to look at all the sites that we mentioned today because you will get them. And in terms of the slides we use, I'm sure Barry from LGIU will send them out to you afterwards. And of course, the LGIU is also involved in this, and they are, if you look on the right of the screen now, you can see a link to them as well. And they call themselves a local democracy think tank, and indeed that is what they are. They do a lot of work around local government development. They run a lot of events and they organize a lot of briefing papers. So if you're interested in finding more about them, again, you can click on the link there and that will take you to it. So let's go through what we are hoping we're going to do today. So if we go to our PowerPoint slide, then you can see that what we are planning to do clearly is to go through place-based services that helps to develop healthy communities. And what we hope to do today is to do these things. And I'll just go through them with you so you know what they are. We want to look, first of all, at the importance of place, the concept of place. Then we want to look at how we develop service and community building around place. Then we're going to look at how place communication and the breaking of silos is important. And Carol Grant, who's with us at the moment, you can see is actually going to be one of our first presenters, and she's already here. We're just hoping the others come on just before the time they're presenting as well. Then after that, we look at agency integration, and we look at a bit of work that the King's Fund has done on that through a video and some of the work that they've done. Then we're going to look at some of the features of place-based delivery. And then we're going to look at how you build up communities to work with agencies in place-based delivery using ABCD, which is asset-based community development. And it's something that many people, including government, recommend that those who are involved in place-based delivery are involved in. And then finally, the two things that we'll be looking at is how you develop a strategy to do that. And we got Alex McCowan coming to join us then, who is going to give us a case study of how they're developing a strategy, how they're setting up a place-based service delivery for a particular group, and tell us the problems and the advantages that they have had to face in doing that. And then finally, we're going to look at the central role of the local authority as a facilitator and as an enabler in helping to develop the place-based approach. And that will be Jonathan Carr-West, who will be doing a presentation then, and he heads up the Local Government Information Unit itself. So basically, that is what we plan to do today. Let me say that what we can do as people are presenting, whether it's me, whether it's the other three presenters, you can type in comments on the right-hand side of your screen. I'm going to type in hello there, and you can see it. And if you want to type in any questions, any comments as we go through this presentation, then please do. Anything you want to ask, we'll try to pick up if we see it as we go along. So you don't have to wait for a speaker to finish. You can do it as you go, because points may come up that you think are relevant and important. Anyhow, let's go back to the PowerPoint slide. And what we're going to do then is look at, first of all, at the place-based approach. And it can be defined, obviously, as something which involves stakeholders collaborating with each other in a specific area. Mentions here neighborhood, region, or ecosystem, but most of us will be doing it within a neighborhood. And the 3 points there really are place, collaboration, and neighborhood. This webinar seminar came about because we've done several events on this topic before, but in a different way. We did a House of Commons meeting, for example, about care and the lack of it in terms of integration in our community. We've done webinars with Carol on loneliness and how you can try to tackle that through place-based initiatives. And what made us really do this is we did a face-to-face seminar with the LGRU a week or so ago on social prescribing, where we tried to set up, or where agencies tried to set up with communities, a way in which GPs can prescribe social, not medical, solutions to problems if they have loneliness, to link them with groups that can help, and so on. And that led us to say, well, that is a place-based initiative. Let's look at it further. And so we decided we would do this webinar in order to try and develop that particular theme. Now, place-based approaches are where delivery takes place, and strategy needs to be developed around that. And of course, it's grown up because of a number of other initiatives which are basically place-based, but were never called that for some time, like neighborhood plans, like community building, like community development, and specifically a thing called placemaking. In a lot of countries, not just here, Australia, Canada, they have been looking at placemaking, where communities, through developing festivals, by developing events, are making a richness out of the communities in which they live. And we've put a link up to a website here, and on the recording you'll see it again, so you don't need to jot it down now, and you'll get this slide sent to you, so you'll be able to look at it as well. But the PPS organization, which is about placemaking in public spaces, and I click on the page on their website here, which isn't too clear, but that's their website, which looks at how placemaking has benefited a lot of communities, how it inspires people to do things collectively through art and different activities, how it connects people with each other, and how they can share. And I think the placemaking concept has been really important in developing place-based service attitudes and approaches. We can look at an example of placemaking in Canada, and we have a video actually which allows you to see what they did there, and it's just over 2 or 3 minutes, two and a half minutes. So let's look at that video first and just see what they mean by placemaking. Okay, I hope you can see the slide now. We finished the video. Carol was saying to me that she couldn't see it, but presenters who come on aren't usually able to see it, but the audience can. So if presenters are here, don't worry about that. The others will have seen it. Anyhow, I mean, that video is interesting because it shows how people love their place, love their area. And it's because of the richness that people who are engaged in their area have that's made local authorities and others realize that if they can deliver service, if they can create service delivery around place, they can do it probably a lot more effectively and in a way that engages the community better. So many people are looking at how health and well-being and care can be driven more effectively by this place-based approach, by looking at places where people live and they're enthusiastic about. But of course, this means changing a lot of things. It means having more integration, more network management, changing the commissioning systems, having devolved pool budgets, participatory budgeting, and looking at shared outcomes. And all that is sort of a new culture for local authorities as well as for others. What we're going to do now is look at maybe one other video, and I'm sorry we're starting with quite a few videos, but this one's about 4 minutes, but it looks at Adelaide in Australia. And I ought to say that there are several countries that have taken the lead on place-based development. Actually, Scotland is one of them. Scotland's done a lot of work on it, as has Australia, Canada, as well as the USA. And this video is taken from Adelaide, where the local authority there, and we're going to hear from Peter Smith, their CEO, looked at the value of place-based development and said that that would be a key concept in delivering local government to their area. He was looking at it in terms of also involving business and how place is important for the development of local business, but he also looks at it in a wider area as well. So it is really, I think, worthwhile looking at that, because it does give you some idea of how one local authority is moving in this particular direction. Okay, so that gives you some idea of one local authority's approach, partly a social enterprise and business approach, but also one which can involve community development and social services and care. And it focuses on how local authorities are thinking about this strategically when they develop it. It's not just something you jump in and do on the hoof. It's something you think out, and you think about the whole strategy of it, which includes looking at how you communicate with people, how you set up network management processes. Local authorities and other agencies are more concerned, or have been concerned in the past, with top-down hierarchical management, but working across agencies and with communities needs lateral management, network management. It involves interagency work. It involves working with the community and with social enterprises in order to develop community building. And all that is important for the development of place-based development. Anyhow, we're going to move now to Carol Grant, who is going to talk to us on some of these issues that we have here today. And if we look, you can see that Carol is a former journalist and director of communications, and she's going to talk to us about the need for good communication, the importance of place, and the importance of breaking down silos and getting involved in interagency work. So Carol, thanks for joining us today and for taking part in this. So I'm going to hand over to you and let me know when you want me to put up your slides, and then we'll go from there. So thanks, Carol, and over to you.
Okay, thank you, Francis, and good morning to everybody that's online for this seminar. If you could just put the first slide up now, Francis, that would be great. Francis has said a bit about my background, and what I want to do today really is to look at how we think about shifting from institutions to people, and what place means to local people. And I'm very much going to talk in sort of generalities from my experience as a communications consultant about effective ways to communicate with people in local areas. So I guess where I'm coming from on this is that I think that people instinctively understand the notion of place, and generally, you know, with a few exceptions, people like where they live, or as Francis said about the first video that we saw, people love their area, and they feel that they pull together as communities. And I think that's something that's, you know, been the case for hundreds of years. Policymakers, I think, are playing catch up a bit on place. You know, if we think about things like local strategic partnerships, total place, the interest now in placemaking, place-based health services, it's very much, I think, public sector organisations trying to understand what people instinctively have known for a long time. So I want to focus on how you as policymakers can really pull together for communities. So if you could just move on to the next slide, please, Francis. I just want to reinforce this point using some examples from the Glasgow Household Survey, which is their most recent resident survey, which is that people like where they live more than the services they get in that place. If you could move on to the next slide, Francis. So I'm not picking on Glasgow here, in case we have anybody from Glasgow. It just happened to be the example I picked at random of a resident survey. It's absolutely typical of the kinds of results that local authorities get when they ask people about place and relationship to the council. So as you can see from this slide, when you talk about satisfaction with an area as a place to live, satisfaction with local neighbourhoods, the figures are very, very high, you know, 80, 90+%. And 3/4 of people in this particular survey in Glasgow agreed that the council had an important impact on quality of life in the city. But when you start drilling down to what people feel about services and what people feel about whether the local authority in this case is focusing on the key issues, you can see that the results are much, much lower. Only 39% in this case thought that the council was addressing the key issues. Again, you know, obviously the exact figures vary, but this kind of picture is really, really typical of a local authority resident survey. So if you could just go to the next slide, please, Francis. So in this example in Glasgow, 93% felt that they would help others in an emergency. 87% could rely on their neighbours to keep an eye on their home if they went away, and nearly 3/4 of people felt proud of their local area. So that's pretty much consistent with what Francis was saying about people loving where they live. If we now move on to the next slide. So we know that people love where they live. They have different views about the public services and the quality that's provided. But how much do they actually know about public services? So if you can move on to the next slide, Francis. The answer is not a lot. These figures come from a mixture of surveys. Again, a lot of stuff from Ipsos Mori, London councils. But it's the case that less than 1/3 of people in England could name the leader of their local council. I think if you ask people to name their local councillor, it's about 6%. And in one survey that was done across London, half the people questioned thought that the council was responsible for the police and for the local hospital. And again, that's not untypical. You know, people just don't know who provides which services. And in two-tier areas, it's very, very typical that people will think that a district council or a county council provides different services. So, you know, 1/3 of people think that county councils provide housing and leisure, for example. If you could move on to the next slide, Francis. This slide is a bit mind-boggling, and it's supposed to be. It's from a report that was done by the Centre for Welfare Reform, and I came across it because I was working on this project for women with multiple needs. And somebody at the Centre for Welfare Reform, when they were producing this report, Women at the Centre, mapped how many agencies a woman with multiple needs might conceivably come into contact with. And you can see it's just quite mind-boggling. You know, even if you take the different sectors, you know, like health or education or the criminal justice system, which are represented by the different colours, look how many agencies and subsectors are within those. And, you know, it's often the case that those agencies don't talk to one another at all, let alone sort of interact with the client in any kind of joined up, meaningful way. And I think that's, you know, obviously in this example, we're talking about somebody who's got multiple needs. But I think even if you were talking about somebody who had perhaps, you know, simpler needs, maybe a parent who was also looking after their children and an elderly parent, for example, you could map that out and there'd be a lot of agencies involved, none of which will necessarily be talking to one another. So what do people want from local public services? If we could just have a look at the next slide and then go on again. The answer is quite a lot. The views in this slide were taken from some work that Ipsos Mori did for a project called the 2020 Trust, which is based at the Royal Society of Arts, and it's looking at future public services, essentially. What the public want is they want public services to be based on notions of the public good. So it's not just what's good for them. So, you know, while we might think that people love their local area, don't care about anywhere else, actually people do have a very strong notion of the public good. And they understand that to be in terms of universalism. And they see more of a potential for themselves in playing a role locally than they do nationally. So there's a great opportunity there, I think, in terms of engaging local people in the future of public services. But, and I think this is an interesting point in relation to getting the message across, they don't see a compelling case for public service reform to cope with either economic pressures or for social change. So, you know, despite a long period of, you know, what we might term austerity, people don't necessarily see that that's a compelling case for why services need to change. Can you go on to the next slide, please, Francis? And there are conflicting views and attitudes, and I think this is a challenge for public servants when you're looking at how to communicate. So the public divides equally on whether they're prepared to see service cuts or whether they're prepared to see their taxes rise to pay for services in future. As I said earlier, they like universal services, they like consistent national standards, but they also like personalisation, they also like choice at a local level. So how do you resolve that conflict or that paradox? I think that's a real challenge for everybody. So I just want to move on to looking at how we talk about public services. And this seminar is all about kind of health-based, place-based services in health and social care. So I took these word clouds from a website called Patient Voices, where they have a number of stories about patient experiences in health and social care. That's a typical one of how somebody was talking about their health. If you move on to the next one, Francis. There's another example, kind of everyday words that we might all use. And another one, again, very, very simple language. And the final one, please, Francis, thank you. So this is when you ask individual patients, tell me about your experience, tell me about the experience of your friends and family. That's the kind of language that they use. If you move on to the next slide, Francis, I took this slide from NHS planning guidance, and obviously STPs, as the jargon goes, are now very, very current as a topic of conversation amongst local partners. But you know, it's complete jargon. You know, in this example, you know, people simply don't talk about allocative efficiency, as we see in the example of this slide. And just on the next one, Francis, I think this one's even worse, actually. Talking about transformation, footprints, digital roadmaps, learning disability units of planning. I have no idea what that means. Does that mean, you know, units that provide for people with learning disability? Is it actually talking about people with learning disability? I have no idea. But, you know, there's clearly a massive, massive gulf between how local people who love their local areas talk and how the public sector talks to them and talks to itself, actually. So what's the answer? Let's just move on to the next slide. I would say from my experience of working in communications, the key is to engage early rather than having the discussions between local public sector providers and then going out to communicate with local communities. Start as early as you possibly can and communicate often. You know, the better the relationship, the more open the communication, the more transparent the communication, the more likely you are to get traction and engage people in what it is you're trying to achieve jointly in partnership between different services and agencies. And I would say also, you know, these days use all the channels at your disposal. We now live in a multi-channel world. People are getting their information from a huge number of different sources. You know, the days when people just read the leaflet that came through the door or read something in the local paper that everybody else read are long gone. I've just given an example there of a statistic from Cisco, which is that smartphone traffic on the web, so people using their phones to access material on the web, will exceed traffic on desktop computers and even laptops by 2020. And if anything, that's probably an underestimate. So, you know, people are accessing information through various different means on various different platforms, and you really have to engage with that if you're going to communicate locally. And I think it's really important to understand the differences between segments of your audience. So really look at how you target your communication to different groups within your community. It might be older people, it might be people with certain needs, it might be people in sort of subsections of a locality. But don't expect them to understand the differences between organisations. As we said earlier, you know, they don't know who provides what, and there's no reason why they should. So if you could go to the next slide, please, Francis. I think it's really important that public services begin to speak the same language as each other. You know, if you look at the jargon in health, and I gave some examples earlier, it's very different to the jargon in local government. And in the same way that individuals in communities identify more with their place than they do necessarily with the local council or the local public sector, people in organisations tend to identify with that organisation rather than the place. And they even identify with teams within organisations more than they do with their parent organisation. So it's really, really important, I think, to try and bridge those language barriers before you go out and communicate with the outside world. And can you move on to the next slide, please, Francis? And I guess the message is, you know, speak in the same way as the rest of the population. I've got a picture of a pub sign here, the Dog and Duck. Alistair Campbell, who was Tony Blair's Director of Communications, now he works for one of the big kind of blue chip PR agencies. He coined this phrase, the Dog and Duck. You know, is this how people speak in the pub, on the bus, at the school gates, in the supermarket? And if it isn't, then you need to revisit the language that you use to make sure that you do communicate with them in that way and that you're engaging people in that way as the start of the process. So looking forward, just moving on to the last slide now, please, Francis. I guess my messages from today would be engaged properly and engaged early. Communities do have the capacity to contribute to solutions. A lot of people want to contribute to local solutions, but I think policymakers will just have to live with the paradox that some people say they want to be involved, but when it comes down to it, they won't actually take part. But feeling able to be involved, I think, is a massive hygiene factor for many people. If they know that that opportunity was there, even though they may not have taken part themselves, it does actually make them feel much more positive to any change that might be proposed at a local level. And I think working across silos and working within the local networks that exist is absolutely essential for success. So that's the end of this part of the presentation. I'm very, very happy to take any questions that people might have.
Okay, Carol, thank you very much for that. That went, I hope, smoothly. And I see Alexander, I think Alexander's joined us as well, and that's sort of that's encouraging to know. Alexander's here because he's on in about 30 minutes' time. Okay. We've got about 8 minutes now if anyone's got any questions. But all right. Well, anybody's thinking of questions, and they may not. Let me ask you a couple. Sure. I mean, you mentioned that councillors, only 6% of the electorate know who their local councillor is. Yes. And is that because you know the councillors don't have the mechanism or the structure to keep relationships, and place-based servicing, networking, is about relationships most of all. So what place-based services does is it creates a new opportunity for councillors to develop a relationship with the people they're working with in a way they couldn't before when they were doing top-down stuff from the local authority. Yes, absolutely, yes. And I think some of it might be about councillors not communicating very well. I think some of it is just a natural kind of apathy or lack of interest that people have about politicians. I mean, interestingly, you know, generally people feel much more favourable towards local politicians than they do to national politicians. So, you know, some of it I think is just down to that sort of natural lack of interest in politics. But there are fantastic examples of councillors really getting out and communicating well with people in their wards. I know LGIU acknowledge, should I say, councillors in their annual awards, and there's some fantastic examples of members using new technology, for example, to hold surgeries by Skype, so that people don't have perhaps travel a long distance to come to a ward surgery once a week. Lots more members now are using social media. I think they're really getting the message that actually you have to kind of go out and communicate across a variety of platforms to get to people. They're not all just relying on talking to the local paper once a week and hoping that they, you know, write a puff piece about what they've done. So I think more and more members are becoming much more communication savvy, and that will help to address that issue. You mentioned that we're looking at sort of health, but we're looking at health and well-being, and well-being includes a much wider area than just health. I mean, it includes employment opportunities. It involves mental health. It involves, how people feel they have a stake in their community. All of those things. Some of the things that Alexander, I'm sure, will be talking about. I hope so. He's smiling, so I guess he will. But one of the things when you're doing that, I mean, you put up that really complex. It wasn't too clear because there was a huge number of agencies working with people who had a particular need in one area. And when you have agencies working in a place and they have to do it from so many agencies dealing with multiple needs, you do need local authorities, health authorities, the police, who's ever involved with the community, don't they, Carol, to develop a different management structure, a different management process. They need to have a network structure which is not hierarchical, and that causes problems, especially for middle managers, doesn't it?
It does. It really does. And I mean, in that example of women with multiple needs, one of the answers to that has been actually having, kind of one physical place where a woman can go and access a variety of services. And you wouldn't necessarily expect all of those agencies to have a presence in that place, say if it was a local centre. But what you would expect is that they're actually all communicating with each other, and the people who are in that centre are empowered to offer advice, or in some cases take decisions affecting that client's needs, if you like. And that requires the organisations to give up some autonomy and to be prepared to empower people at a very local level to help the people who are in the greatest need. And I think you're right. It's often people in the middle management structure who feel most threatened by that. But it has to be a change going forward, I think, because those old structures simply don't work for people anymore.
And is that partly because you're personalising the services? You're no longer looking at education and social services and care and employment. You're looking at a person.
Absolutely.
And you're looking at their total needs, and that can't be departmentalised.
Yes, absolutely. So, for example, just to take that example of women with multiple needs, one of the issues they found is, for example, if perhaps a woman had got into trouble with the law, had to go to a probation office and ended up sitting in a probation office at the same time as a partner who had been, accused of domestic violence, for example, that might be a very unsafe, unwelcoming environment for her. So actually, you go back to what that individual needs. What are the factors that will result in a good service for her? It's about somewhere being safe. It's about somebody who, overlooks her case, who can join up all the dots and see what needs to happen. So it's absolutely right. It's centred around the person, not the institution.
John's asked an interesting question, actually. He says, is there an effective way of bridging the communication gap, which is what you've talked about, or the divide, especially with people with English as a second language, or with disabilities or visual and learning impairment?
Right. Well, there are all sorts of ways that you can do that, I think. Again, I think if you take the question of English as a second language, then it's about connecting with people in local communities who can act as a conduit to talking to people in their own language. For example, there's not much point in translating material in some communities where there are very low levels of literacy. So you need to understand that before going out and necessarily kind of wasting a lot of money on the wrong type of communication. So I would say, as much kind of local interrogation and understanding of what that community or a subsection of that community needs is essential. Again, with things like visual impairment and learning disability, there are fantastic pieces of technology out there to help with visual impairment, and particularly accessing information online. with learning disability. There are lots of organisations that produce information in kind of easy read formats, and there are organisations that specialise in producing information in that way. So I think, you know, there are lots of possibilities there, but it's about going back to being person-centred rather. So, you know, how do you engage with that person rather than thinking about how do I broadcast my jargon-ridden message out to the world? I think it's a mindset change really that comes first.
Okay. All right. Well, Carol, thank you for doing that and for your presentation and answering the questions. And I hope,
Okay.
John, that helped you with your question as well. So, you know, that's your part done. So thanks a lot. You can go and have your cup of coffee now. And we know
Okay.
and we know the technology's worked on this so far.
Yes.
So, you know, fingers crossed it's going okay. Okay. Thanks, Carol,
All right, you're very welcome.
for doing that. Okay, well, let's go back to, I mean, Carol talked about integration and breaking down silos. And the King's Fund is an organisation that's done a lot of work about that. They've done some work on integrated social care, and they've produced a number of publications on it. And if we're looking at how integration works in the way that they see it, we do have a video which again is about a 3-minute video, which comes from the King's Fund, and it's worth watching that now just to have a look at how they see that integration working. You'll all see it, but I should say to Alexander, you won't be able to see the video. You're on presentation, so don't panic if you don't see it. Okay, so that was a short video, but I thought it was nicely done in an animated form, which gives you an idea of what the King's Fund thinks about integration and the importance of integration, and concentrating on the person. Now, they've actually done quite a few publications on that, and I've just put these up here, as you can see. I mean, you don't go to them now because they're PDFs, but I put them there so when you get the slides, if you want to go to those publications, you can. I mean, the first one is on place-based approaches to NHS, and that's the one there, and you can go to that if you want. That one actually is produced by Chris Ham, who runs or is CEO of the King's Fund, and Hugh Oderwick, who is in his office. Hugh was possibly going to come on this webinar today, but he's away from London and couldn't, but I'm sure we'll do something with him on another occasion. So there's that publication, and then there's the other one, which is place-based approaches in the NHS. And I think they're both really worth looking at, but you will be able to get those when you get the slides of this. Some of the points that came out of those reports are some of the things that Carol's already mentioned, and some of the things we're going to talk about as we move along in this webinar. And one is that place-based approaches about building on people's existing capabilities in a community. And it's about reciprocity and mutuality. In other words, it's not about a local authority or an agency deciding what a community wants. It's about the community saying, building on what they want, using their strengths and services to develop that, and the local authority or the other agency, whatever it may be, working with them on a reciprocal basis, and building the right support networks as well in order to actually provide that safety net to make it work. And it's about blurring distinctions, and I think Carol dealt with this as well, that when you have interagency work and when you're dealing with relationships in a community, people don't care what your formal position is in a local authority or a health authority. They don't really care what sort of manager you are or how many people you have under your control. They're interested in what you can deliver, how you can relate to them. They're interested in relationships. So the distinctions between an agency and a community often get blurred, and the distinctions between people's different roles gets blurred, and that takes a lot of getting used to. And it means also that local authorities and other agencies have to facilitate rather than deliver directly. They've got to see what package can be delivered, not be delivered, but can be created in a holistic way, often by the community doing that themselves. And that means recognizing people as assets, and we'll come to that a bit more in a minute. It also involves, as Carol said, overcoming the silos and the interdepartmental conflicts that goes on. But when we talk about building on people's assets, we're talking about building social capital in an area. Social capital is often called the glue that holds society together. It's about the hidden strengths that people have that are very often underused and not identified. And if agencies can work as facilitators to identify those skills and those gifts that people have and build on them, an asset-based approach as it's called, then a number of amazing things can often happen. And it often means too that when you do that, you can reduce the demand for services because you get people at an early intervention state, and you therefore prevent problems further down the line. So it's very much about engaging communities, and that is an important element in the collaboration and the partnerships that take place. So one of the ways in which government and others argue that we should go about this particular process is through what is called ABCD, or asset-based community development. And an asset-based community development is actually about building social capital. It's about not looking at the deficits a community has, but looking at their strengths and finding a way through exchanges and ways of networking to bring those skills and gifts out that people in the community have, so they can help solve the problem that they may have. And asset-based community development is now becoming a very widely known movement. And indeed, one of the leading advocates of that in this country is Cormac Russell. And we've done 2 or 3 videos or webinars with Cormac Russell, where he's looked at the ABCD approach to community development. How do you build up those strengths of a community, and how do local institutions work with that community, building on the existing community strengths which are actually there? Well, we've got a little video of Cormac talking about that, and it's worth looking at that. This again is about 3 minutes, but Cormac is a very persuasive person, so I'll let him speak for himself by playing this video. Okay, so Cormac, who is a very eloquent person, I think, has sort of explained that asset-based community development approach, which he has done a lot of work on, and he works with lots of local authorities. And I know he works with Croydon, for example, in which they have, in a place-based way, developed community building through ABCD, asset-based community development. There's a report on that, actually, on asset-based approach to place-based delivery by the Improvement and Development Agency. Now that no longer exists because it was the successor to the Local Government Management Board, and now both of those have gone. But the report that they've done is still quite useful to see, and it's still available. In fact, if you look at it, this is it here. And if you want to click on the link on the previous slide, when you get the slides, you can also download that as well. If we look at that, the asset-based approach, what that report basically said, and I'll say this very sort of briefly, they talk about the glass half full, which is what the asset-based community people talk about all the time. We should look upon communities as glass half full, not empty. It's about strengths, not deficits. And it's about trying to create capacity, skills, and knowledges and connections in a community. It's a shift from the deficit approach. You don't go in and say, you know, what are the problems in this area? What are the needs? And you deal with the deficits. You go in and say, what are the strengths? What can people bring to the table? And how can we help people bring and grow their own mutuality? So it's a different culture, both for the community and for professionals who work with that community. And it means that councillors and staff have to be willing to share power. They're not doing things for people, they're getting the community to do things for themselves. And it's long term and it's open-ended, it doesn't stop. And professionals find that very difficult, because they want, especially when they have to account to commissioners, they've got to have targets, they've got to have outcomes. But very often in asset-based approaches, in place-based development, the developments are open-ended. The positive cumulative effects of the unintended consequences are often more than the intended ones. And commissioners and statutory authorities find that very difficult. But it's a culture we've got to gradually shift into. And we have, it's a way to empower communities and get people to work together on the same issues. It is about partnership working. It is about a non-silo approach, as we've said, a people-centered approach. But it's not about, you know, an alternative to investment in services. Cormac is often saying, and he says quite often, you know, we're not replacing services. There will always be the need for some services, but you need to get the balance right between service delivery and community building. And this is going to have an effect again on how we commission the development of areas that want to get involved in community building and service delivery in a place-based way with ABCD, asset-based community development. The commissioning process needs to be probably radicalized in order to be able to cope with that. Many people argue that that hasn't happened yet. And of course, the other thing is that that when you do develop a very successful project, and we're going to look in a moment at a strategy that's being developed to what we hope will be a successful project, what you're getting is a new form of leadership, and you're also getting a new knowledge base. And one of the important things that the report says, and others say, is that when you have this new knowledge base, we then got to find a way of having knowledge transfer and letting other people know what's happening in order that you can replicate what's happening. Though the report does give a word of warning that replication can not always be exact. Community knowledge and community engagement is different from place to place. It's very rooted in where people live. And so consequently, although you can take a model and use it as your base, you can't take it rigidly. You've got to be flexible and work with the community, amend it and change it in any way that is appropriate to that community in which you're working. Anyhow, so we've looked at some of the issues involved: community engagement, the asset-based community approach, the breaking down of silos, the importance of communication, the importance of networks and a relationship approach rather than a hierarchical approach. And we've looked at how integration is important, and we've looked at how the community needs to be engaged. So the question is that when you're starting up doing something like this, how do you create a strategy? How do you set about it? And what do you do? Well, we've got Alex with us today, Alex McCullum, who is a researcher at the Learning and Work Institute, and he is involved in developing a project with young people, I think around employment particularly, and other things as well. And they're in the stage of developing that strategy, which will be very much, as he said to us at a meeting I went to a little while ago, a place-based approach. So if I asked him if he would come along and if he would actually tell us about how he set up what he was doing and how he developed it. So Alex, thanks for joining us on this, and I'm going to hand over to you now to tell us about how you developed your strategy and the problems and the opportunities it created. Hello, Alex. Hi, Alex. I don't think you're there. You may have to log out and log in again. I think I will have to get in touch with Alex. Oh, no, he's gone. He's seen. He'll log on again in a minute. Just to remind you, while he's doing that, if you can put any questions on, please do. Alex is just logging in again. Our first technical hitch, the webinar has gone really smoothly so far, and that's great. Sometimes when you do these webinars, you do get people who have problems when they log in and coming onto the site. Alex came on earlier and he was fine, but I think he just went off. I think his connection is not probably as good as Carol's was, but we'll wait and see. But if any of you have questions, please add that to what we do. Well, what I'll say while we're waiting is that there are a lot of web pages on place-based development, which I think are really valuable and important. And what I'm trying to do and might try and do, and I'll show you now, is that I found a really nice piece of software that brings together all websites that are around a particular topic and turns it into a small ebook. So for example, this one, I'm trying to build up. I've only just started it now, but if we can build it up, we'll send it out to you afterwards, because it will have put in a very readable form some really, really good web pages on placemaking and place-based delivery. So hopefully we can do that and send it out to you. I can't guarantee it because we're only just beginning to do it, but I think it's really quite a good thing to do if we can. So look out for that in case we do. Right, let's see then if we can go to Alex now. He's come back to us.
Hello there. Hello there. Sorry about that. Hello everybody, and thanks very much for inviting me on, Francis, to speak about the Jobs Plus demonstrator. So my name is Alex McCullum. I come from work for the Learning and Work Institute, which is an independent policy and research think tank, and we focus on policy around employability and adult education. So if you could just move on to the next slide. So what I'd like to talk to you about today is the Jobs Plus demonstrator, which is a new intervention that we're going to be trialling in the UK. So I'm going to tell you a little bit about what Jobs Plus is, why particularly we believe that a place-based approach is going to work for the problem that we're looking at. And then I'm going to give you some information about some of the key learnings that were originally discovered from the intervention when it was piloted successfully in the US. So moving on to the next slide, Francis. So what is Jobs Plus demonstrator? If you just move on. So in the US, the Jobs Plus demonstrator was an intervention that was designed specifically for social housing tenants. And it was about ensuring that people in social housing where there was high rates of unemployment, high rates of poverty, had a bespoke response to those problems. So it was intensive employment and support for jobs. Importantly, whilst these sorts of interventions exist already, in the model that was used in the US, there was also new rent rules that the housing associations or housing projects put in place to make work pay And that was all about ensuring that whilst people moved towards the labour market, increased their hours, and became more sort of economically independent, they didn't find that their income actually went down instead of up, as their benefits and various other support systems started moving away and dropping away from them. As a community-based intervention, importantly, the support that was provided was supported by neighbour-to-neighbour peer support. So in the US, the model provided us. Sorry, apologies, the slides have just disappeared off the screen again. The model was supported by local communities. Local communities, and people in those communities were supported to be able to work together in partnership to try and deliver a new momentum for these communities to make sure that they were able to move towards work. So moving on to the next slide, please, Francis. So what is the problem that we're actually trying to address? I've kind of highlighted that a little bit now. In the UK, we have a similar situation. Housing associations or social housing tenants often live in communities that are, relatively speaking, more impoverished and have higher rates of unemployment than we see in other housing tenures. So people who own their own properties and even private rented. As you can see there from the diagram, actually 1 in 4 people, people are 4 times more likely to be unemployed or inactive in social housing. Moving on to the next slide. The important thing to point out here is that whilst social housing tenants are in some ways very different in terms of their demographics and some of their circumstances, some of the issues that they have to deal with in terms of high rates of unemployment, higher rates of lower rates of income, higher rates of poverty, even controlling for some of the circumstances that people live in terms of their education, age, demographics, those sorts of things. There is still, as we said here, an unexplained effect from living in social housing. What that is difficult to always say. And I wouldn't want to cast aspersions on the communities that we're looking to support, but importantly, if you use a place-based approach, there's not really any need to cast aspersions because you're probably closest to the questions that need to be answered. So moving on to the next slide, please. So what did Jobs Plus achieve in the US? Now, we're presenting this information now because this is what we're looking to try and achieve in the UK. The intervention in the US was successful in 4 of the 6 pilot areas that it was piloted in. 2 of those pilot areas did struggle to get started, but for the 4 that did get started, they saw a persistent increase in wages and higher earnings and employment, and this persisted for a long period of time, so 4 years, as you can see from the diagram. This was actually tested in the evaluation using a randomized controlled trial, so testing against comparison sites, comparison communities. And it's one of the interesting things that I noticed from the report is that for those sites where residents who had been supported were able to stay in their communities, so didn't move on, those gains were actually greater. So it seems that by increasing sort of community resources and improving the lives of some people, there was kind of a virtuous circle maybe. But obviously that's the experience in the US, and we want to see if that's the case for the UK. So moving on to the next slide, please. So what do we want to achieve in the UK? So what we want to achieve is an intervention that we can test. We're working with our colleagues in Give Us a Chance, which is an association of housing associations, social landlords. And we want to create a place-based intervention, but we're going to use it in a saturation model approach. So I've been sort of describing it as a bit of a blunderbuss approach. We want to make sure that everybody in those particular communities are all focused on the problem at hand, which is increasing employment for people in their communities and increasing earnings and prosperity. So what we're going to do there is we're going to create a one-stop shop for job coaching and delivering all various different supports to overcome barriers to getting into work. So skills, there might be issues around financial capabilities, and also once people are in work, We're looking to make sure that we can support them with job coaching to see that they, if they're able to, increase their hours and increase their earnings. Much like the US model, what we want to do is make use of the social networks that might be there in the communities already, making use of local actors, voluntary organisations, and some of the support systems you'd expect to be involved in this sort of work. So DWP in the local areas, Job Centre Plus. But importantly, we are going to be trying to engage the communities themselves in these projects to make sure that that there's ownership within those areas and that the support that is provided is exactly what's needed. So moving on to the next slide. As I mentioned, in the US, this was tested by using a randomized control trial. So what we're currently doing at the moment in this scoping work is working with our colleagues in Give Us a Chance to identify a number of sites that we can roll out this approach. We need to spend some time deciding on what sites are the best ones to use, not only to make sure that the right tool for the job is being used and we're actually trying to solve the problem of low rates of employment, but also make sure that we've got comparison sites so that when we do this work and we run this pilot, that we're able to then evidence well the fact that it will have worked, or hopefully that it will have worked in the UK, and then bring that evidence to decision makers to see if we can roll that out further. And so moving on to the next slide. And just to give you some details here, at the moment, our criteria for inclusion, so for the different sites that we might select in this trial going forward, is making sure that we've got communities with social renters making up about 50% of those communities, so there will be a concentration. We also hope to, well, we also expect to see that in some of these communities that we identify, there'll be incredibly high rates of unemployment or economic inactivity. And as you can see there, we're expecting that the community between
It sounds like he has frozen again with his connection. You'll notice that in a minute, I hope, and come back on. I'm glad to see Jonathan's on. Thanks for joining us early. I saw you were on twice for a moment, and I thought we were going to have you talking to yourself, the two pictures, which would have been quite interesting experiment. I mean, Jonathan, did you came on and you saw part of that? I'll use this while we're waiting for him. I mean, did you find that interesting in the sense that that place-based work can involve housing associations and so on? And do you see a role of a local authority when they're doing that, or do they stay outside of that?
Well, I think that will depend in particular on the place. I mean, I think in most places there's going to be a role for the local authority as a convener, as a facilitator, as the holder of a democratic mandate, which of course other organizations, and I'll talk a little bit about this later, but other organizations in the public sphere, however good they are and however important they are, housing associations as an example, they don't have that direct, you know, although they are accountable in various ways, they don't have that direct link back to the electorate. So I think local authorities can provide a couple of things in that sort of context. They can provide a kind of strategic overview that sort of sees, for example, housing in relation to social care, in relation to planning, in relation to management of public space, but they can also provide so they have that kind of overview, but they can also provide a sort of link back to the community in terms of the democratic accountability that they provide.
Okay. Anyhow, Alex, are you there? Oh, I think he's having real problems with his connection at the moment, which is a great shame. I might come back to him in a minute, Jonathan. Would you mind if we did your presentation now, because you've just done a link into that, and you know, I asked you about the role of the local authority, and one of the things that we want to do, obviously, is talk about the role of the local authority, and that's central in some people's mind to place-based development because of the link with councillors and because of the coordinated approach. So do you want to actually talk about that now and go through the role of the local authority? And I'll come back to Alex in a minute.
Sure. Well, I think it's absolutely. I mean, I think it's hard to have that conversation about the local authority's role in delivering place unless we sort of take a step back and think about how the role of a local authority is changing and what it needs to become. Because I think it's important that we don't have that conversation solely in terms of what a local authority currently is, but we have it in terms of what a local authority will evolve into being. And to do that, I think we need to understand some of the challenges and some of the constraints that local authorities face. Local authorities have, the most immediate of those is a squeeze on finances. So local authorities have very, very little money. Their pockets are bare, as it were. But I think they're also, and that's set to continue. We've seen, just the first slide is just a sort of a humorous illustration of that. But we've seen local authorities take up to sort of 40% out of their budgets. They've done that in many ways very successfully through sort of back office merger, through efficiency, through rationalization, through shedding staff. All things that have been painful for them as organizations, but which actually have largely protected the public from cuts to frontline services. But I think there's a question about how far that can continue. Many local authorities feel that this year, next year is going to be a time when that really starts to bite. When people are really going to start to notice that their services are declining, that there isn't enough money to deliver key services. That it's particularly true in terms of adult social care. We heard nothing about that in the autumn statement yesterday, and as people queued up to point out, that service, that critical statutory service, is on the brink of collapse right away. So there is a real challenge for local government that they just cannot afford to keep going as they are. And as I'll come back to why that's a sort of driver for place-based services. We've also got some more contingent issues going on. We've got Brexit. Next slide, which continues to be, to dominate, I think, the political landscape. That has a couple of features for local government. The first is that there will be, there are likely to be knock-on economic effects. There are likely to be, challenges with investment, challenges with jobs, challenges with recruitment to key public services. I mean, in many parts of the country, for example, over half the workforce in the National Health Service are non-UK nationals. The status of all of that now seems somewhat up for grabs. So there's a huge sort of challenge around Brexit, and it also creates a challenge around government's focus. So there was an interesting Institute for Government report last week which concluded that the civil service had the capacity to deliver Brexit, but only if it stopped doing everything else it was committed to doing, which is obviously not going to happen. So there's a challenge about the sort of level of attention and the level of support from central government, which is also perhaps an opportunity. A degree of inattention may be to our benefit. But I think what I'd want to suggest is that neither of these immediate factors are the real challenge that local government faces. I think, there are actually a whole set of challenges to do with how the world is changing. So, we see an aging population. Increasingly, people are living much longer lives. The number of 100-year-olds, for example, in this country, and I'm not saying that the chap on the slide is necessarily an illustration of this, but the number of 100-year-olds in this country is due to go up 100-fold to 1 million by 2070. Think of the pressure that places on key services. Think about a changing global economy. Jim O'Neill, once the Goldman Sachs, then of the Treasury, now no longer at the Treasury, was the first person to talk about the economies: Brazil, Russia, Indonesia, China, India and China. We've seen India and China become these economic powerhouses. Jim O'Neill now talks about the mint economies: Mexico, Indonesia, Nigeria, and Turkey. I think the point is not that, you know, there's a prediction about the Mexican economy or the Indonesian economy, but we know that it changes. We know that centers of economic power around the world change very rapidly. We know that the places that will be sort of economic centers in 20 years' time are not the ones that are now. And actually that has an impact for the type of jobs we need, the type of skills we need, the type of education we need to be providing for kids, the type of businesses that will be on our high street. All of these things come home to roost at a local level. So there's a massive sort of set of global challenges that I think place a huge amount of pressure on local authorities. And these seem sort of abstract, but they are local. They're about, you know, who's going to look after, you know, who's going to look after your granny? Will your kids have houses to live in? Will they have jobs? What sort of businesses will be on your high street? Will your neighborhood be safe? Will it be flooded? Will it be, you know, all of these big challenges actually get dealt with at the local level. Now, that in turn leads to a sort of need to transform services. And this is where we come back to our theme of place-based services. You know, we know that those major challenges are characterized by speed, by complexity. We know that they can't be solved just by business as usual. And we know that they can't be solved just by government, either by central government or by local government acting alone. They require an engagement of all parts of the public realm, of civil society, of individuals, of communities, of businesses, of public sector organizations. All have a role to play in contributing to the sort of innovation we need to meet some of those key challenges. So, you know, if you take an aging population as an example, you know, in a world in which you have the number of very old people with very complex needs increasing up to 100-fold, what is the answer to the question of who looks after those people? Now, there will be a variety of things will come into play. Families will be offering more support. Communities will be offering more support. People will be, you know, investing more in the sort of annuities and financial products that will secure their living in their old age. The answer won't be, don't worry, the council will do it, because there will be too many old people. There'll be not enough resource in the council. So that will have to change, and I would suggest it will require an engagement of different parts of the public realm to do that. And so the broad shape of public service reform starts to become clear. We need to move from a system that's geared towards acute intervention to one that's characterized by demand management, by prevention, by the integration of services, by multi-agency working, which is co-produced by, designed around the needs of service users. And I think not only does that mean, as I say, recognizing that these things can't be solved just by the state acting alone, and they need this sort of collaborative engagement, but it also means thinking about the total asset base of a community. So if we want to ensure that our kids have the right skills, if we want to ensure that local economies are recovering, if we want to ensure that older people are looked after in their old age, we need to think about what resources exist within the community. That means thinking about civic energy, you know, the sort of innovation and the sort of engagement that can come from communities and from civil society. It means thinking about social networks. You know, we know, for example, that the biggest determinant of well-being in old age is not health, it's not wealth, it's how many people visit you, it's how strong a social network you have. Yeah, and yet we never talk about the sort of construction of social networks as a goal of public policy. It means we need to think about early intervention, not just as thinking about investing to save, though that's important also, but in terms of building capacity and resilience. We need to think about how we structure incentives for action, for markets, yes, but also for citizens. And I think it means we need to think about what sort of networks for social action exist within our communities, and they do, and how we align public services with them. Now, I think there are two sort of ways of thinking about that. The first is that, or the two important factors in that. The first thing is that it's a category error, I believe, to think that we can achieve that through central government departments and their agencies, because things like DWP, things like Department of Health remain overwhelmingly geared towards acute intervention. So the King's Fund estimates, for example, that only about 5% of NHS spend is geared towards prevention. And despite endless initiatives, Total Place, community budgets, troubled families, actually the vast majority of public spend, and remember that 72% of public spend is still spent by central government, the vast majority of that spend is sort of channeled down these sort of ring-fence silos from big Whitehall departments, which fail to integrate at a local level. So that's why we need a degree of devolution. But the devolution that we have had so far in this country, I think, has been very much a sort of top-down one, a sort of very paternalistic, government stretching out its godlike finger and sort of devolving a little bit of power to local government when it sees fit. And I think we need to reverse the terms of that exchange and really root power at a local level. But secondly, we need to think about how we join up services across place. That is likely to involve some restructuring of local government. It's likely to involve, I sometimes talk about it as sort of little fish eating a big fish eating little fish. We need to think about what sort of appropriate spatial level to join services up at. And we need to think about how we intervene across the course of people's lives, from birth through to old age and even to death. How do we achieve that kind of joined up, integrated public service approach? I would argue that does require us to think about places, because actually, if you are not thinking about place, if you are not thinking about a unit of space within which communities operate, within which you can engage people, within which you can draw on civic energy, then it all becomes too abstract. It all becomes a kind of theoretical model. You have to root it in the places that people live, the cities, the neighborhoods, the counties. And there is a challenge here about what we mean by place. But looking at a spatial level across places and thinking about what are the resources that exist here? What are the needs that exist here? What are the aspirations of this community in this place? What are they trying to achieve? How do we help them to become self-actualizing, to become, to have agency, to become able to fulfill their own aspirations? What support do they need in that? What sort of early intervention? What sort of capacity building? And by thinking that through at the level of place, instead of thinking it through in terms of services and those service silos that come down from Whitehall, you start to create the possibility to join up services, to connect budgets, to engage people. You create what we sometimes call a sort of synaptic approach, where local government moves from doing things to making things happen. Local government moves from the deliverer or commissioner of services to being the sort of agency that facilitates, that sparks, that catalyzes people to do people within communities to do things, that generates social action. And that, it seems to me, is a fundamentally different way of looking at the world. It's a sort of reversal of the map. So that we put place and we put communities and we put people at the heart of our approach, rather than thinking in terms of services. And that, I think, there's a lot of agreement around that, and there's a lot of there's some energy around that. But it does pose a challenge for local government, because it requires a completely different way of thinking about what local government is and what local government does. It requires local government to move from thinking of itself as a sort of bureaucracy that delivers services to thinking about itself as a network or a set of connections that joins up parts of the community, that seeds ideas, that catalyzes action, that has accountability through its democratic mandate, that represents communities, that talks, gives them a voice, that allows them to express themselves. And that's a very different way of thinking about what we do. Now, there are examples of that, and I think we could point to work they've done around health and social care integration in Greater Manchester, for example. We could point to some of the troubled families initiatives that we've seen around the country, notwithstanding the criticism that those have come under recently. the challenge at the moment is that those things remain in a sort of pilot, what I sometimes call pilot. They remain marginal, they remain on the edges. And I think, part of our challenge here is that we need an account of change that allows those kind of individual, great examples of different ways of thinking about services to add up something transformative. And I think we lack, we don't, there's a lot of thinking at the moment around systems thinking, around transformation. I'm not sure that any of that quite achieves that level of change. I think perhaps, and I put this as a question to finish with, perhaps place gives us the sort of key to thinking about change in the way that we need for the future.
Okay, thanks. Thanks for that, Jonathan. And that was Jonathan Carr-West, by the way. I didn't get a chance to introduce him properly because Alex disappeared and Jonathan came on straight away. Jonathan is the CEO of the Local Government Information Unit. He's done a webinar with us before and has joined us in seminars as well. So thank you for that. If you could stay around, I'll try and get Alex to finish what he was doing and then ask questions to you both. But Alex, a couple of points have come up during your discussion, and maybe you want to take those on board as you're talking. One is, I think Darren is asking what measurement tools and method did you use in the development of your project? And Lindsay is saying, in relationship to what Jonathan said, is that the importance of place-based work means that housing associations and local authorities can and should work together. But let me go over to you, Alex, and then maybe you want to take those points up and then follow on with your presentation. Okay?
Yes, in terms of housing associations, I think housing associations really do have an opportunity to play a massive part here. We were talking, I was hoping to be talking before, just before I dropped off, about leveraging in local support and making use of local resources. And one of the key factors around that, in my view and in my experience of other projects I've worked on, is that there is particular buy-in already in existence when you make use of local resources. When you bring a new project into an area, new relationships need to be built. Those things take time. A new intervention, but with existing partners, gives that opportunity, if there is those existing good relationships, of course, for you to trade on those relationships and make use of that. In terms of the measurement tools that we're looking at, I think if I carry on with the presentation now, I can go straight on to that and give a little bit of detail about how we're looking to achieve it. So I wonder if you could go on to the slide that we left off at, Francis, and I'll talk a little bit about some of the data that we've actually looked at to try and identify communities to work with. So we were talking about the right tools for the job. And in our view at Learning and Work, and gave us a chance as well, I think that targeting resources for where they're most needed is particularly important, and those resources need to be focused in the right way as well. Quite often there could be resources in action in a community, but there could be overlap. There could be gaps that haven't been identified if the data hasn't been looked at properly. And also, as I've just mentioned, when you're nearer to the problem, you've got a better opportunity of understanding the problem. So if we could go on to the next slide, I think I'm going to talk about the typical communities that we're hoping to be helping, and almost the sort of weasel word of the fact that thinking about typical and thinking about the general rather than the specific is where possibly sometimes the problems arise in trying to intervene in social problems like we're attempting to do here, and actually change it from a general to a specific approach, and place-based allows that to do. So the data that we received from the housing associations now already has allowed us to identify a number of communities that would be a good target for the intervention that we're trialling. On average, these communities are about 500 units in size, and well over half of those properties are general needs stock. Now that means basically properties that are for working age adults with no specific needs around disability, for example, or older people. And with those sorts of numbers, we're looking at working in communities with somewhere in the region of around 1,000 individuals, working age adults in there. If you can just move on to the next slide. So this diagram here, little bit busy. This is some example data that we used when looking at some of these communities. And we're looking at some wards, Alexandra, Lewisham Central, and Llanhilleth in Wales. So that's Oldham, Lewisham and Blaenau Gwent, the local authorities respectively, in which those wards reside. The data on the right-hand side there just gives you some of the key statistics for England and Wales. And when we start drilling down to the specific, to finding the place, and your comment earlier on, Jonathan, about what is place, I think often it's interesting to see how things change as you narrow the focus and you actually see there are differences between communities. Some people may consider Oldham to be quite a sort of homogenous area, very similar communities and neighbourhoods in that area, but Alexandra stands out as having an area of high economic inactivity and quite high rates of unemployment. Likewise, Lewisham Central, another area, has only marginally different problems in terms of unemployment as they do with the rest of the area. And then Llanhilleth in the valleys of South Wales, again, there's a great deal of difference in terms of the rates of employment, those people who are actually economically inactive and unemployment themselves. If you just move on to the next slide to continue this analysis, looking in further detail in terms of issues around economic inactivity due to ill health, quite often economic inactivity can be as a result of mental health problems or treatable conditions that with support can be dealt with. And then Llanhilleth, where they have very high rates of individuals with absolutely no qualification whatsoever, goes to show that when you're looking at even though the probably stay problem, and we're looking to improve rates of employment, the circumstances in which those problems are solved are very different. So whilst we're looking at trying to a framework of support, different communities, we know that by creating a framework we're going to be able to target particular problems and particular barriers that are affecting those communities. Moving on to the next slide.
Yeah, can I hold you? I think we're getting feedback. I think if you could mute your microphone, Jonathan, I think it's probably coming from you. If you can mute your microphone, we wouldn't get the feedback. Sorry. Anyhow, let's try again. So carry on, Alex.
Okay, thank you very much. We'll get there in the end. So if we could just move on to the next slide, just going back to this idea of the right tools for the job. Just moving on to the next slide, Francis, thank you. I think those two diagrams there just identify the fact that looking at individual places, there are assumptions around what the problems might be. And a framework that we're looking at, we want to achieve the same overarching ambitions, but the problems in those local areas can be very, very different. And those communities can be very, very different. Oldham on the edges of a large conurbation, Greater Manchester, Lewisham Central right in the centre of London pretty much, and then somewhere like Llanhilleth, which is in the countryside, a very rural community with incredibly poor transport links. The problem is going to be very different. So targeting resource means that you can get extra support, you can get extra influence in those areas to try and change behaviour, and possibly in the communities that we'll be working with, behavioural change might be an issue that needs to be addressed, this unidentified effect of living in social housing. And this is what we're saying about the right tools for the job. A consistent approach may actually achieve inconsistent results. You know, at the moment, the kind of services that people can access if they're out of work are consistent across the UK, but we don't see a consistent result across the UK. As I mentioned earlier on, it's about focusing resources for what they're needed most as well. And our work in collecting data specifically on some of the kind of demographic and unemployment measurements that you can get from national data sets is important. But having a local approach is also really useful, because then you can make use of local knowledge and understanding and getting opinions of where the experiences may differ from the data that's being collected. So whilst we're working with housing associations, we're going to be working with their local partners as well to see what's support is currently available, but also importantly, how much of that support is being used and maybe why it's not used. Being local and having a place-based approach means that you can be much more specific and better understanding the problem. So, for example, we might be having issues with poor transport links, but if we look in a very geographically defined area, it might be the difference between poor transport links or a particular service not running at the right sort of time. So early bus services to get people to the local train service, or the local centre of economic activity, wherever that might be. And I've mentioned this already, and I'll just mention it very, very quickly. Using local resources allows you to gain traction. So if there are trusted resources already in effect, and these are some of the resources that we hope to lever into the Jobs Plus model in the UK, you might be able to trade a little bit on that trust and actually then get working and get delivering effectively a lot more quickly. So moving on to the final couple of slides, what do we think are the key elements of success for this kind of approach? And actually, interestingly, listening to some of your previous speakers, these have been touched on already. The experience from the US, there's a lot of literature that's been generated on the Jobs Plus model in the US because it has been running for such a long time. Governance is a key factor for them. They understand that there's, because of the objectives that are trying to be achieved, there's a defined group of a defined partnership with key stakeholders that need to be involved in that. In their circumstances, obviously, it was the local housing authority, some of the welfare teams. In the UK, we're looking along those same lines, but obviously trying to leverage in health support as well where we can do, but also ensuring that there is a person with responsibility to drive things forward. First among equals was the turn of phrase that they used there, and in my experience, that is very important. A responsibility for everybody to take a part in something doesn't necessarily mean that one.
Hello, Jonathan. Can you unmute your microphone?
Yep.
And could you mute yours, Alex? That's great. Yep. Okay. Yeah. So we just had a problem with Alex. Dropping out. But Lindsay was saying that devolution might mean professionalisation of local authority people and councillors, and that might go against the informed that people need to create and place-based services.
Yes. And I think it depends what you mean by professionalization. I think, many elected leaders already take a very professional approach. I think this is a difficult one. I mean, yeah, in a sense, a lot of council leaders are already effectively professional. They get an allowance. I mean, it's relatively small, but if you're the leader of a council, you can just about manage on it. And most council leaders basically do that as an almost full-time job, albeit a fairly low-paid one. But you do have a split, obviously, between politicians and the sort of and the officers within a council. I think that split, it feels to me, works well. And I don't think there is. Michael Heseltine sort of consistently argues for just sort of getting rid of that and just having elected professional leaders of local authorities that combine the chief exec and the leader role. I think there's limited appetite for that. I'm not sure it's necessary, but I think, I think if by professional we mean acting professionally, if we mean supported with appropriate training, if we mean, reflective and about how they do their job and sort of taking it seriously as a job, then absolutely we do. I think we are, we have that to some degree, but there, clearly there's room for improvement.
And John, I think you're getting feedback from me. I'm not sure why. But John says, what extent joined up working, something that Whitehall is concerned about, and they're not understanding the funding implications.
Absolutely, it's a very good question, and as John points out, local government understands all this quite well, and local government understands the limitations of central funding. But until we get some flexibility from central government, then this conversation, as John points out, just goes on and on and on. And indeed, of course, large aspects of this feel familiar. And it was last week or the week before, it was 40 years since the Layfield Commission, which discussed many of these exact things. So there's a sense that nothing ever really changes in relation to some of this stuff. Look, our Whitehall department's discussing it. I think this is a pretty bleak picture. I think there are very few Whitehall departments that are really engaged with this issue. I think some are paying it lip service but aren't really doing it, and many others just aren't interested. So do we see any serious progress on this from the Department of Health? I'm not sure that we do. Do we see any serious engagement with devolution and localism from DWP? I'm not sure we do. I would love to be proved wrong, but I just don't see that happening. However, there are sort of, this is where I think the sort of devolution process that we've seen in Greater Manchester, and to some extent in Liverpool, and to some extent in Sheffield City region, does give us some chinks into that sort of Whitehall armour. You start to get social care budgets put together with health budgets, for example. It's a small step, but it is a beginning. So, no, Whitehall, I think, will have to be dragged kicking and screaming to this place. But I would say, and this is not necessarily a positive way of looking at it, in the end, a place-based approach becomes necessary, because actually there will be a sort of resource impact, and in the end we will not be able to afford to continue to Whitehall siloed way that we currently do.
Okay, I think that you are still getting feedback from me. I think it's coming from your end. Because somewhere is picking me up, and I'm not sure if anyone's listening. Let's see if that works. No, it's not yet. I don't know if you've got one of your speakers or anyone's listening close by.
No, there shouldn't be anything close by. My phone is off, I think, so it should.
Okay.
There shouldn't be anything to interfere.
Okay. Well, let's. I mean, Alex is gone. Let's try to conclude. We're getting very, very close to the end. But how do you see the future of place-based service delivery? Is it something that you think local authorities are taking on? Or are they being distant? Place-based service delivery.
Right. I didn't quite catch the final bit of the question, but I think what I would say is, we will inevitably have more of a focus on place-based delivery of services as central government's capacity to deliver services declines. Central government's capacity to deliver services will decline for two reasons, as I've suggested. One, because of the divergence between growing demand and shrinking resource, and two, because increasingly the types of services that people will require and the types of services that we need are not the type of thing that can be done by central government. So I think we will in time see a sort of exposure of the limitations of national government in terms of their ability to deliver services locally. We therefore get more of an emphasis on place, but I think that could happen in a positive way or a less positive way. So one option is that you just get a sort of vacuum where increasingly places are just left to sort of pick up the pieces, and that is likely to lead to increased political discontent and disconnection. And I think we're already seeing quite a lot of that in both in this country, in Europe, and in the US. And it will, frankly, to a much lower level of public service provision. I think the more positive future on where transition in a more strategic way, and places are equipped to, funded to, and given the powers to create joined up services, to invest in prevention, to think about the sort of assets of communities and the skills that are needed to sort of draw those out. So, in conclusion, I guess place-based services are acceptable, but the choice is whether that's a sort of strategic porter choice or whether that arrives just through failure.
Okay. Thanks very much, Jonathan. I guess we'll end there. It's a pity we missed just the very last bit of Alex's presentation. But you will get the slides. And you get the slides to Jonathan as well. So thank you everyone for attending. And thank you for the speakers for taking part. And we'll put the end caption up now. And that will last for a few seconds. And then we'll finish the webinar.